Kandahar and in Kabul, they've met with the Afghan Red Cross Society and the IFRC, and they've met with government leaders. The program here is that the three are going to take a couple minutes and share their observations and their thoughts on their time in the situation in Afghanistan. At that point, we'll take questions. If you could please, journalists, if you could please raise your hand and I will call on you, or if one of the leaders wants to call on you, of course, that also works. A small note, everyone here is aware that while these three Red Cross leaders have been in Afghanistan for the past week and working on Afghanistan and talking to Afghan people and Afghan leaders, we're well aware that the global headlines right now are focused on Ukraine. And if you do have questions on Ukraine later in the call, at the very least, Robert Mardini will be happy to answer those questions. So with that, I'll go quiet and Robert, please take it away. Thank you very much.
Thank you very much, Jason, and a warm welcome, and really thanks to all of you joining us today. Your presence is all the more appreciated, as Jason said, in view of what's going on, sadly and tragically, in Ukraine. And let's be honest, these are competing news stories for you guys. So unfortunately, it can be really difficult to ensure that international attention stays focused on the humanitarian situation playing out in Afghanistan. So again, thank you for helping us shine the media spotlight where it is really needed. The purpose of our visit, together with my colleagues from the Finnish and Danish Red Cross, Christina and Anders, has been really to see firsthand the dire humanitarian needs in Afghanistan, so that we can really make the strongest possible case to the international community, to donors, to unblock funds that are badly needed through strategic engagement. And I cannot overestimate or overstate the urgency of this. Icrc has been present in Afghanistan for 35 years, and we remain it remains one of our largest humanitarian operations in the world. We have and continue to work very closely with the Afghanistan Red Crescent Society, the International Federation, and other movement partners in the country, such as the Finnish Red Cross, the Danish Red Cross, and others. We have stayed through various changes in government, and that has not changed now. We are still there. We are beefing up our response. We really want the people of Afghanistan to know that we will continue to stand by them as their future remains uncertain. And let me be clear here, the crisis in Afghanistan is dramatic and now goes far beyond what can be described as a purely humanitarian crisis. What we are seeing is really the perfect storm. We are seeing the cumulative impact of more than 4 decades of conflict, recurrent droughts, the COVID-19 pandemic, and since the recent events of August 2021, a rapid slide towards total economic collapse. Now, 6 months after the Islamic Emirate of Afghanistan took control, the IEA, resulting in international sanctions and the freezing of aid, we've seen public services really on the verge of collapse, with the central bank effectively paralyzed, the civil servants not being paid, and poverty becoming more and more entrenched. We had this visit at the electricity utilities in Kandahar, and over the past 25 years in the humanitarian sector, I have often heard from electricity authorities requests for generators, for fuel, for transformers, oil for transformer cables. But this is one of the very few times I heard a clear request for food for the staff. And this request featured very high in the list, unfortunately. And I think this resonates across public services in Afghanistan. Healthcare services are certainly among those in most urgent need of support today. Just one place where we saw this very clearly a couple of days ago was the Icrc and movement-supported Mirwais Regional Hospital in Kandahar. This hospital serves a population of up to 9 million persons living in the southern part of the country, with some 4,000 sick or wounded seeking treatment every single day. This is partly because the current crisis caused some smaller healthcare facilities to close down and many practitioners to leave the country. We all have heartbreaking impressions of what we were able to witness in this hospital. 3 kids sharing one bed, rising malnutrition, not only when we met children, but also young adults, and overcrowding across the various wings of the hospital. And this is a hospital that is generously supported by the Red Cross Red Crescent movement. You can imagine the situation in other less lucky hospitals across the country. And what is happening in this hospital is just one example of dire needs among many others across the country. We also still see attacks on health workers, as we have seen yesterday with this appalling killing of 8 polio vaccination workers in different locations across the country, something that at the Red Cross Red Crescent movement we condemn in the strongest possible terms. And it's a reminder of how difficult the operating environment is in Afghanistan. Humanitarian response is clearly vital, but it cannot replace a functioning public sector and ensure service delivery for 40 million people. What is needed most urgently today is the salary payment for some 500,000 public sector civil servants, ensuring that critical services are able to function, and resuming technical support to the central bank to relieve the banking and liquidity crisis. That is today, I would say, the mother of all bottlenecks that is holding back the country and communities to have a dignified life. Our message to the international community and donors, in a nutshell, is this. It is possible for you, and it is critical for you to distinguish between the type of development aid that might be used as political incentive and aid that will help ordinary Afghans to survive by ensuring that government institutions can deliver basic services and prevent economic collapse. And here it is really a matter of life or death for countless people that you do so right now. There has been some welcome progress on some restrictive measures that help facilitate humanitarian response today, including the UN Security Council resolutions in December last year, allowing some exemptions in the sanctions regime. But clearly, much more needs to be done to avert an all-out disaster. And for our part, the Icrc today is supporting 28 hospitals across the country through the Hospital Resilience Project, including directly paying the salaries of around 10,000 health professionals, medical nurses, and this support ensures today access to healthcare for up to 20 million people. So it's really a critical support, and it accounts to close to 85% of the total bed capacity, hospital bed capacity in Afghanistan. We're doing this in support and in close coordination with the Ministry of Public Health. It is our view at Icrc that the provision of essential services should be provided in support of and in close cooperation with the Afghan institutions, such as the Afghan Red Crescent Society, the Ministry of Public Health, and other technical ministries. Parallel systems will only undermine and further weaken the very institutions that have been built and supported over the past 2 decades by the international community. Let's not forget this. Next month, we will be launching a budget extension appeal at Icrc for more than $50 million, most of which will be used to help provide assistance to the country's hospitals and medical staff. Put simply, it's to ensure the operation continuity of those hospitals and ensuring the continuity of hospital services. Working closely with the Afghan Red Crescent Society and other key partners from within the Red Cross Red Crescent movement and beyond, including development actors, we are of course ready to scale up and replicate this model, including to other key sectors. And as we speak, work has already started for uninterrupted safe water supply in urban centers through support to water and electricity public utilities. I think it is now the right time for me to hand over the floor to our friends at the Danish and the Finnish Red Cross societies to also share their perspective. Thank you, Jason. Over to you.
Christina, when you would like to go next, please.
Okay, thank you. Thank you so much for joining us this meeting, knowing that headlines are elsewhere. But basically, the main reason for this journey we made with Robert and Anders is to make sure that the Afghanistan situation is still in the news. I have only three issues to add. I think this is something Robert covered most of the things, but I would emphasize that I've been of course following the Afghanistan situation because of my role in the Finnish Red Cross for a long time, and of course I thought I could anticipate the situation, humanitarian crisis in Afghanistan. But I think, as particularly when visiting Kandahar, the hospitals and seeing people, we realized the situation is really bad, and Red Cross and our humanitarian actors certainly needs to step up and increase the humanitarian efforts in the country. As I don't go and I don't repeat what Robert Mardini already said about the health sector, but this is certainly something I think we all were shocked almost, the situation, how it is. The second goes to the situation in Afghanistan. We, as Robert said, we met with various authorities and actors in Afghanistan. And I think it was quite striking how many, actually all of them were interested in putting in place the mechanisms of accountability and transparency. They are, from my point of view, at least genuinely interested in how to build a system which is combating corruption, which is creating a system where transparency is built up. And of course, it's not the role of the humanitarian sector to solve these kind of problems, but we are very much dependent on this system because, of course, we are accountable to our back donors, our public, when we are working in Afghanistan, and it gives us very great trust and hope that we are able to report back the results we have received. And of course, it is quite interesting to hear also that these issues which are on the agenda, all governments and actors in the world, it's very much higher on the agenda of government in Afghanistan today. I was not here because I'm a woman, but of course, as a woman, I followed the women's issue also. And I must, what is the reason? I do have difficulties to say, but I was happily and optimistically surprised how many women we saw in the hospitals, in the Ministry of Health, in different sectors of society. I was particularly very happy to visit in the Health and Science Institution, where ICIC is paying salaries for teachers. We met about 20 coming midwives, female midwives who were about to finish their studies. And of course, this is something what we need to see in Afghanistan, more and more people in the health sector. But also we saw the very strong-headed teacher who was very good guide for us to teach us what is the situation in the health sector in Afghanistan. So at least the information I got now, or what I saw, is very encouraging. It doesn't mean that all is well, but I think it's encouraging in the future to see women working in the important areas of of society. These are basically my reflections from this trip. Thank you. I give it to Anders. Please, Anders.
Thank you, Christina. And from my side, let me start by reiterating what Robert said, that it's really a heartbreaking humanitarian situation you face in Afghanistan. In my 30 years of humanitarian work, I have never seen such a stressed out health system as is the case in Afghanistan. A 300% occupancy in a hospital with 4,000 new patients every single day is something you do not see every day. And the number of malnourished kids and also young boys and girls were staggering, and they were growing by the day. So it is a growing humanitarian crisis. It is a situation that is out of control and that needs a lot more support from the international community. However, what was also striking to see is the resilience of the Afghans, as well as the resilience of the system in this country. For more than half a year, many of the institutions that we have visited have not been paying out salaries to the staff. They have not been able to supplement stocks of medicines and consumables. Anyhow, they have kept on working, maybe not on full speed, but 2/3 of staff has been working without salary, has been stretching the resources to the limit. But what we're also facing now is that it's 12th hour, that there are not much left of resources, that staff is exhausted and need a helping hand beyond what we have been able to do so far. It's also impressive to see that the investments that many Western countries has been doing in Afghan institutions over the past years, they are still alive. So everything is not lost. Those who have been trained, those who have been capacity built as institutions, as professors, as health workers, they are still around for most part. So we still have an opportunity to actually save many of the investments that we have been doing in Afghanistan the past 20 years. But that requires that we engage, that we have dialogue with authorities, that we supplement in our way and under our conditions the structures that are still functioning. Because if we let those structures fall, then we are in a situation where we can start totally all over, and the humanitarian situation is just going to worse and worse and worse, and there will be no sustainability in the long run. It is not easy, but the meetings we had with the institutions gave us hope that they are willing to accept our conditions, to accept our impartiality and neutrality, and live up to international standards on transparency and accountability when it comes to humanitarian assistance. There is a need to increase our engagement. Icrc, the International Committee of the Red Cross, is going to increase their engagement. We as national societies will increase our engagement as well, primarily with the Afghan Red Crescent Society, who's the only really national represented civil society organization here. In 33 provinces, there are volunteers from the Red Cross, Red Crescent, who are out there doing a difference every single day. They could do more, they have to do more, and it is our ambitions to actually help them do even more than they do today, because the Afghan people really need more support in this very critical situation. Thank you, Jason.
Thank you to you three for your observations and for your time in Afghanistan this past week. At this point, I'd like to ask the handful of journalists that are on this call, if you do have a question, please use the function at the top of this team software where you see the smiley face raising a hand to indicate that you have a question, and I know to call on you. While we wait to see if there are any questions, Robert, I'd like to ask you, given your experience now for so many years with the Icrc, what's your view on how, when there are multiple crises happening at the same time, how one crisis can affect another? In this case, what effect does the situation in Ukraine have on Afghanistan? Either in terms of funding, either in terms of the needs that Afghans have. I assume there's no effect there at all. But how do these two crises play against each other?
Well, this is a good question, Jason. And having served also for the Middle East at the time of Arab Springs, and when we've seen multiple crises happening almost simultaneously, it's always a challenge because unfortunately we're seeing more and more of those crises adding up, adding humanitarian despair, suffering, and we're seeing very few crises ending. So it's always coming on top of, and the risk is always to end up with the forgotten crisis. I mean, today, if you take Yemen, for example, none of the problems we have seen in Yemen have gone away, and yet Yemen is almost absent from the spotlight of the media. Afghanistan has been relatively visible since the spectacular changes in August, and that kind of garners some sympathy for the Afghan people, including funding. Now that a conflict is rocking Ukraine, and I don't want to speculate now on the dynamics of this conflict, it is clear that the very states, the very donors who have been following very closely Afghanistan will deflect their attention to something that is happening as we speak in a very fluid, dynamic fashion, and that is closer to Europe and the West. So this means for us at Icrc, in the Red Cross Red Crescent movement, and the broader humanitarian community that we need to double down on bringing or spotting or shining a light on the plight of the people in Afghanistan, because none of the problems we've been following have gone away. On the contrary, we're seeing the humanitarian situation deepening and people facing more uncertainty and many services at the verge of collapse. And on top of this, you have the poverty, the economic collapse. So we have to be multitasking as humanitarian organization, but I think the international community and the donors should also multitask in terms of also lending their attention and channeling the generosity of their taxpayers to those pressing crises.
Thanks for that, Robert. I hope I didn't take you by surprise when I played the role of journalist there. We just had 3 people join the call, and because of the limitations of the software here, I can't tell exactly if you are a journalist or maybe you're a member of the Red Cross team. If you're a journalist and you have a question, could you please use the raise your hand function, or even just unmute your mic and go ahead and ask a question? Because now is the time for that before we hang up, because I'm not seeing a lot of questions coming in yet. But before we do hang up, Christina, I'd like to ask you, you touched on the fact, there, I'm going to be quiet and let Lu Xuan, go ahead, Lu Xuan, please unmute yourself and ask the question.
Hi, hello. Hello.
Hi.
Yep, go ahead. We can hear you.
Yeah. Okay, great. This is Li Shuangqi. I'm from China Central Television. And my question is that now we can see that Afghan people are really suffering a humanitarian disaster. But before President Joe Biden ordered to free up Afghan asides held in the US for families of America's 9/11 victims, what's your opinion about that? Because we can see that Afghan people, they really need help.
Shall we take Jason other questions or respond?
I think go ahead. And if there are any other questions, please raise your hand now and we'll call on you after this answer. But I think go ahead.
No, thank you for the question. And I mean, we have been consistently saying that humanitarian aid alone will not solve this unfolding and deepening humanitarian crisis. And we need the international community. We need the development aid that was abruptly interrupted in August to kick in again and to support Afghan institutions. So unlocking the news of unlocking Afghan assets is a welcome news. Now it needs to materialize in concrete terms and get into the economic and financial system in Afghanistan. And this is clearly something that is not happening yet. And as I mentioned earlier today, the bottleneck in Afghanistan is really the fact that the central bank is paralyzed, that there is a very acute liquidity crisis that is paralyzing the vast majority of Afghan institutions, that is holding back the authorities today to pay salaries to close to 500,000 public civil servants who run hospitals, who run water pumping supply schemes, who run schools and all other critical public services. So in theory, good news. What is needed now is really to have the banking system work again to absorb these funds and ensure a certain level of normality in the economic situation in the country.
Thanks very much for that question, Li Xuan. Saeed, I see that you joined. I don't know which Afghan media outlet you're from, but if you have any questions, this would be a great moment for you to come on, turn your mic on and ask. But if not, of course, absolutely no problem.
Hi, Mr. Madini and
Hello.
everyone. My name is Syed Azwan. I'm from Islamic civilization from Malaysia, called Icrc. I just want to know. I'm sorry, I'm a bit late joining you guys. How is it? Is actually the actual situation now in Dayanis? We understand that the banking system is still not working in Afghanistan, and even the access to the country also it's not open as it's supposed to be before the takeover of the Taliban government. So I have one question: how can we journalists, even let's say from Malaysia, want to cooperate with let's say Icrc in terms of in terms of coverage of humanitarian program in Afghanistan, especially in health sector, and how possible can we do that? To do that, Mr. Madini.
No, thank you very much, Syed, for the question. Again, today, Afghan communities are facing the combination of decades of conflict, repeated cycles of drought, threatening their livelihoods, exacerbating food insecurity, and on top of this comes COVID-19 and the recent economic collapse. The manifestation of which is really the disruption or the paralysis of the banking system. So today, the good news is that humanitarian aid is possible. There are carve-out in sanction regimes that allow humanitarian funding to reach humanitarian organizations such as the Icrc, such as the partners within the Red Cross Red Crescent movement, such as the Finnish Red Cross, the Danish Red Cross, and others, the Afghan Red Crescent Society. So there are practical ways for the people of Malaysia to contribute to this, for instance, through the appeals of Icrc, of IFRC, that will reach directly Afghan people and communities. For instance, through the hospital resilience programs that today, and you just arrived, I mentioned it earlier, offer services to 20 million Afghan people. 28 hospitals running today, accounting to 85% of the total hospital capacity bed, is really an important program that is having a direct impact on the health of hundreds of thousands of Afghans, and this is something worth supporting. And it's easy for any government to support this through the ICRC appeal. Through the ICRC appeal, you can support a program of supporting clinics in rural areas, 120 of them, or the Norwegian Red Cross, for instance. So there are means to contribute, bearing in mind that the country today needs much more than humanitarian aid, because it takes more than humanitarian aid to run a country of 40 million people. And this is why our long-standing messages to the international community is to reactivate the development aid to Afghanistan. Afghanistan, before the takeover of the Islamic Emirates of Afghanistan in August, was dependent on external aid up to 80–85%. So this support is critically needed. Over to you.
So Jay. You are saying there is no issues in terms of humanitarian access, and the present government are accommodating the delivering of assistance to the Afghan people, right?
I mean, that's correct. We met with authorities. They reiterate to the Red Cross Red Crescent movement to operate everywhere in Afghanistan according our principles of impartiality, neutrality. So we are very encouraged by this. Now we need to take into account that Afghanistan is still a very volatile and complex environment. Yesterday, 8 polio health workers were killed in an appalling attack in 8 different locations. So access is theoretically supported by authorities. We don't feel as humanitarian players any blockages from the authorities, but there are dangers, and we need to really be very careful in delivering humanitarian aid. So it's this is not specific of Afghanistan. This is the case from Syria to Yemen to the Sahel, the Horn of Africa, Myanmar, and others.
So is there a possibility for any NGOs or body from Malaysia to cooperate with you guys in ICRC in Kabul?
I mean, yeah. I mean, there are NGOs here. There are any NGOs should reach out to the authorities to get, as in every country, to get a permission and a visa. But there is not only possibility, but also a request from authorities to beef up the humanitarian response. So I don't see any signals preventing that from happening. Sorry.
Thank you, Mr. Mardini.
You're welcome.
Syed, thanks for those very important questions that you asked. It's a very good back and forth on your part. I'm just going to call on one other person. I don't mean to put you on the spot, but I know that Anna Nordentoft has joined us on the call. And I wanted to see if there were any questions, particularly for the Danish or Finnish leaders. That would likely could be a question that comes from you, Anna, but obviously you're not obliged to do so. And yeah,
I'm listening with great interest. I don't have any questions right now. I was just rereading my notes. So you were saying that you visited 2 hospitals, right? In Kandahar and Kabul, and the ICRC manages or supports 28 hospitals. Is that right? All right. No,
That's
just
correct.
getting my notes straight. Thank you.
okay.
Now, the second hospital we visited in Kabul is the only specialized hospital in neurosurgery. So it's a critical hospital that was also running almost at 95% of its capacity. And it's a critical hospital to support, because if this service is not available, patients should seek support outside the country. And since it's very difficult to travel and to cross borders today, it limits greatly. So this is a critical hospital as well. And we will be visiting together with Christina and Anders tomorrow another hospital in Kabul and our physical rehabilitation center that helps people recover mobility.
Thank you for that. Before we sign off, I wanted to just offer the opportunity, Christina and Anas, did you hear anything that Robert said that you wanted to amplify or add on to? No pressure, of course. Just before we say goodbye, I wanted to make sure that you had any final thoughts.
Thank you, Jason. Maybe the one thing which has come up today, and I'd like to emphasize that at the moment, the understanding and impression we got, there is no restrictions in Afghanistan to give a humanitarian aid. And this is, I think, particularly important when we think about the role of Red Cross Red Crescent movement in Afghanistan. So we have access to people in need in different parts of the national society, in the nation. And I think it's valuable to reiterate what Anders Laregard said, that we have a strong national society of Afghan Red Crescent in the country who has access also. So this is, in that sense, I feel quite comfortable and secure that if there are resources to deliver, we are able to do that. This is my main message, I would say. Thank you, Jason.
And just from my side to emphasize what Robert was stating, that this is the time also for engagement with institutions in Afghanistan, and that we understand that donors have been hesitant for political reasons and acceptable reasons and understandable reasons for development aid, but for humanitarian initiatives and for the time to engage with institutions here in Afghanistan. Thank you.
Excellent. Thank you to you three. Thanks to everyone who's joined the call and the journalists who have asked questions. Very good exchange. And that's the end of this press briefing. Questions, you have our contact information. Everyone have a great day.
Thank you, Jason. Thank you, colleagues. Bye.
Bye.